But what I'd like to do is warmly welcome Matt Miller for our second presenter today. And if you had the opportunity to read his bio, you may have noticed, like I did, what a humble and knowledgeable human he is. So Matt believes that while it's important to work on any challenges, or so-called deficits relating to mental health challenges, focus needs to be on the strengths of the individual. So Matt is a passionate psychologist with a history of working, so I'm going to go through a million things, but I don't know what he hasn't done. So he's worked in injury management, organisational wellbeing, individual and EAP therapy, vocational transition services, a school psychology, alongside managing wellbeing services across the state for a really large NGO. Not only does Matt have extensive knowledge and ability to speak on his work with ADHD or adults with ADHD, but he has his own lived experience after gaining an adult diagnosis himself. We are very fortunate to have Matt talk to us today about the symptoms, the diagnosis, ADHD versus trauma, strengths and passions of ADHD individuals, as well as some intervention. Come on up, Matt.
Thanks very much, Cindy. I don't proclaim to be a very clinical psychologist, if that makes sense. I like to kind of run things pretty informally. There's a formal element to today, obviously, with the presentation. And picking up from, I guess, Jason's words, about 25 being the decline. With working memory and stuff like that, I'm already traumatised. This is quite apt. I guess today as well, there might be some questions. Please try and hold it to the end. However, if there's something really pressing, feel free to perhaps interrupt. If I don't get things out clearly, please stop me. If I do the odd segue and then come back 10 minutes later, let's just put that down to ADHD. We'll get there. And I kind of look up to the corner a fair bit, so maybe you can spot some of my symptoms and personal traits, and I'll try and stand still as much as possible as well. Why? Actually, I won't. All right. Adult ADHD and trauma. I'm going to kick off with a bit of a story first. So hopefully I can get through this rather quickly. But I think it's a nice place to start, and hopefully give some realism to what I'm going to talk about, and see if I guess it might resonate with a few people. All right, so this particular person was a well-mannered and very shy boy. And he was always quite sensitive emotionally. He excelled at primary school and high school from an academic perspective. Although he was quiet, undisruptive at home and school, he was a good sports person and had a large group of friends, forged through being able to turn his hand to many sports. This was especially true in footy, t-ball and baseball, and he made elite junior and adolescent teams in the latter too. As an adult, he'd been an elite A-grade cyclist, training up to 20 hours a week. He had a nutritionist, a coach, and he made a National Road Series team for a couple of races here in Perth. There was a strong pattern of being all in or all out, perhaps being too impulsive to quit when negative feedback was provided by other people. Despite his previous hard work to be able to compete and secure his place with a few things. If he's going to do something, he does it very well, or not at all. This has left him with some regret with both his baseball and his cycling, alongside his high school studies. I've got C below, so I'll get to that bit. His ADHD traits and symptoms symptoms weren't immediately obvious and went largely undetected by his parents and even him. His parents would argue that his attentional problems, ability to focus, and his overthinking are just trademark that he's had from his childhood. And they began to surface through early school, especially when this particular person provides some context to his early experiences. As an adult, he's become pretty bloody talkative. Yet, some disorganisation, poor planning have come to the fore, especially since he and his wife have had kids. However, he's a very active and invested dad. This person has always bitten his nails. He has a habit of picking the skin on his face. He can tap his feet, and that's especially true when he must sit still. He can remain seated, but he will change his posture frequently or fiddle with things. Like at school, he did pens and he doodled on paper a lot and got told to concentrate. He was a child, was always playing games or sports and would be extremely bored sitting indoors unless he was playing with his Matchbox cars, which he would spend hours on end doing. Even if his older brother, who was also diagnosed with ADHD, as an adult, or his sister were not willing to play, he'd head out on his bike, make jumps, throw or catch a ball on his own, go kick the footy and fetch it himself, swim in the pool or go to a friend's home. He could be out all day. He'd forget to drink water and go to the toilet. He would always rather be bored at someone else's house rather than bored at home. This remains to this day. He's always on the go. He even notes as an adult he still doesn't like being at home indoors for extended periods, feeling restless sitting still. And he can't stand it when it rains because he can't be outdoors. He gets super frustrated and people will tell him to piss off and go for a ride. Even now, as an adult, we often see him doing multiple things at once, like putting on the dishwasher, setting the table, picking up rubbish, tidying, picking up after the kids and keeping them amused all at once. He still loves his sport. He gets agitated and moody if he doesn't exercise. He'll never go on a bloody beach holiday because he can't lie down on a towel for too long. There was a time around 5 or 6 years old where this young person was very unwell, but he'd just lie around and not say too much. And it wasn't until he was taken to the doctor that his parents found out that he actually had pneumonia. And that required him to go to hospital straight away. The parents discovered later on in his life that this particular person didn't like talking about thoughts or feelings too much, as he was just distracted by them in his head. He didn't actually know what to say, how to say it. Sounds pretty frustrating. In his teens, this particular person secured a scholarship for aeronautics at Kent Street High School, but it was 2 bus rides away from his home, and that's about an hour, hour and a half each way, back in the 90s. Hated catching the bus. It was extremely boring and loud. There was no aircon, couldn't stand it, and this was prior to mobile phones and what have you. He was easily irritated by others on the bus, and that hindered his mood, alongside having to put up with the travel time and the stagnancy that came from those bus rides. This made him feel pretty restless inside, in fact amplified that restlessness. But again, he didn't really say too much. He just noted to his mum and dad that he wanted to change schools. This resulted in him changing schools to be closer to home and begin year 10. This was another later regrettable decision by this particular person. Being assaulted by his so-called friends at the new high school, some 12 months later. This person noted that he was inattentive to others' behaviour and taunts, and when his prowess in sports did not assist him with his friendships, he was bullied. Throughout high school, with his aeronautics scholarship, he wished to become a pilot. He was quite focused on this, and thus the ceasing of his aeronautics scholarship was a real surprise. That said, he maintained attendance to his studies to a high level. This was even during a very stressful period post that assault, and he returned to Kent Street, albeit minus his scholarship. He felt like a failure. This was amplified by the fact that he would study a lot, and he'd be in his bedroom for hours on end. It was full of books, shit on the floor, scrap pieces of paper everywhere, and a very messy desk. His belongings would remain contained in this shithole, even when his parents built an extra room on the house to move all of his study gear into. Little known to his parents, this person found it very difficult to retain and recall information read in books or texts without rereading or rewriting the material constantly. He would get annoyed if anyone moved his stuff, and his parents didn't realise that his extended time in his room was due to struggling to retain information. They just thought he was very, very studious. Isn't he amazing? He's the best kid ever. He's so much better than his brother. And they thought that he loved studying. His feedback, however, was that he struggled with it, but he wanted to do well because of his sense of failure previously, that he seemed to suffer through it. He needed 2 tutors, one for maths and one for physics. He's never read books for pleasure, even at a young age, finding his mind can wander while reading, so it's difficult not to become bored with having to reread paragraphs, or be very frustrated that he can't actually stay on task. Challenges retaining information and using that effectively now continue, and it was the same at university. This person said to his parents, I just follow all the smarter people around and copy all the shit they do. Or I just talk to people a lot, ask them lots of questions and find out what they're studying. What should I be looking at? This probably helps him become less shy, and now they can't shut him up in most social situations. He would leave his assignments to the last minute, complete them over 1 to 2 days, be late for tutes and lectures, and or go socialise at the university pub, get a jug of beer and eat lots of kebabs. He had difficulty organising his diary, self-motivating to get study and reading done. This was more prominent at university where he had to be more self-motivated. He would cram for most exams and assignments, and he found out that the assignment box would be left open after hours, and if one put their assignment in the box before the office opened the following day, it would be stamped the day prior, thus allowing him an extra day to get his task done. Pretty smart guy. Even now, if he's got a boring task to do, he'll probably leave it till the last minute, so that's the only thing that motivates him. And he also underestimates how much time that's going to take, so his stress goes through the roof. This extends to being consistently late when arriving somewhere, especially for family events or outings, despite advising of what time he will arrive prior, and he gets just a bit anxious about this, because people comment on it all the time. Lastly, this person appears to be a deep thinker and creative, yet this probably stops him from initiating things, being distracted by his own thoughts, even when trying to concentrate in conversations. This can see him take a lot of time to explain himself, or go on about things too much. He reported guilt and a sense of embarrassment at times with that. He can then be overly apologetic, seek reassurance, and overcompensate by doing lots for other people.
So he'll take on work around the home after working all day, and that leaves him even more tired and fatigued. And that's been a trait since being a child. What do you think? Anyone resonate with that here? Okay, thank you. Buy a beer later. Or a shandy. Alright, so did anyone guess who that is? Alright, so probably a little bit of trauma in there as well, like there was the bullying and the assault and stuff like that, but I think I probably, I don't know, with my internalisation of things and overthinking, probably traumatised myself a little bit as well. So yeah, it's not just the physical stuff, it's the emotional. And I think in my lived experience, one as a person and then secondly as a therapist, it's all kind of trauma, I think. It's just to what degree, yeah. But it's all personal too, so no one's trauma is greater than anyone else's or less relevant. Okay, start the actual presentation now. Yeah, so today's agenda is to look at the origins of symptoms. There might be a little bit of overlap there with Jason's. Diagnosis of ADHD and trauma. Again, comorbidities. What's the difference between ADHD, trauma and some others? We'll be looking at, the strengths and passions of ADHD in individuals, and some interventions and approaches that can be helpful dealing with both, ADHD and trauma. Alright, so in line with Jason's presentation, ADHD is inherently genetic. Some people may have a different view. Overall we just need a lot more research done, to be honest. I was reading an article last night that a client sent me, and they've been forwarded that by their partner, and it's extremely distressing for this particular person, saying that his ADHD is all just, in his head, and it's to do with the childhood that he had. So completely invalidating. So you can imagine, the distress that would actually come from that as well. Again, I won't sort of harp on this too much, but dopamine plays a massive part in ADHD presentations, probably trauma as well, and they exacerbate each other. And there's limited evidence about sort of non-inherited factors, but research is starting to take off in a few different places and spaces, and it would be a great thing if people can, start to focus on, these non-inherited factors a little bit more. Okie dokie. So up here I've got diagnosis of ADHD and or trauma. What are the chances of actually being diagnosed with ADHD if I have trauma, or vice versa? Are there any comments out there about that?
I started seeing a psychiatrist when I was 28, and then I got diagnosed with ADHD. Does that mean I've only just got it, or could have had it my whole life and just not been diagnosed? Because it's not genetic in my family, so...
Yeah, look, it's usually a retrospective diagnosis. So you've probably had the traits your whole life. And whether they've been compensated for by something, or you have had certain environments where they've been masked. Female and women don't stand out.
It doesn't always have to be genetic because...
No, it doesn't.
just a real one.
Yeah, there's lots of other factors in terms of, look, you know, even low birth weight, oxygen at birth, you know, substance use, you know, like parents, those sorts of things. Yeah.
So, it seems like you might be maybe implying that people with ADHD feel things a lot stronger. I mean, you said, of course, each individual person thinks their trauma is the most, but could you say something to feeling things stronger?
I would, in my own experience, yeah, I think I feel things a little bit stronger sometimes, and a lot of my clients would as well. So, I don't know, I think there's like, you know, when the adrenaline goes up and the cortisol levels go pretty high when we're distressed, probably get the adrenaline blinkers on a bit and make things a little bit worse than perhaps what they are. But that experience is still relevant to the person, you know, so yeah, it's trying to, I guess, get the periphery being looked at a little bit more and those alternate perspectives coming in, and then managing, I guess, those kind of adrenaline and body-based responses, which I'll talk a little bit about soon. All right, so yeah, like, I guess what's come first? Is it ADHD or trauma? For me, it's probably the ADHD. And the research would probably say that at the minute as well. Yeah, there's a couple of other theories around the place. I can talk to people about the other theories perhaps outside of the context of this presentation. So come and grab me afterwards. They're pretty controversial. But they do have, I think, some interesting ways of still trying to treat ADHD as well. All right, so they're not completely irrelevant. ADHD is, and individuals who reported clinically significant childhood ADHD symptoms also report significantly more types of trauma experiences and more PTSD experiences than those with low or no ADHD symptoms. So I guess the reasoning behind that is that, you know, perhaps I'm a little bit more of a risk taker. Maybe I'm a little bit more hyperactive, put myself into dangerous situations. I might be inattentive to other things as well. Perhaps more likely to use substances in my teens and young adults. And yeah, sort of getting myself into those more risky situations. Okay. Maybe my parents did too. Maybe they didn't model the best behaviour. Maybe they didn't see it. Yeah. Maybe they didn't apply appropriate boundaries. Yeah. Maybe the person with ADHD found it really difficult to actually follow their advice or their boundaries. Okay, so yeah, pretty difficult. All right, trauma can often be misdiagnosed as ADHD. Trauma symptoms and ADHD can coexist, just like those other comorbidities with anxiety and depression. I'll talk about this a little bit later on in the presentation as well, but trauma screening should actually be part of every ADHD assessment. If there's a high likelihood of individuals with ADHD having trauma, then we must be talking about those things that will lead to better treatment outcomes and the right interventions being applied at the right times. All right, and they kind of go hand in hand in terms of exacerbation of different symptoms and or traits.
Sorry, Matt, just while we're waiting, could you just define trauma for everyone, because it might be a different understanding by different people?
Yeah, if I can, I guess, take the approach of well, there's numerous different types, I guess is kind of what you're saying. It's like, yeah, so it's not just your assaults or bullying or a motor vehicle accident or being caught up in a conflict of war or a natural disaster or anything like that. It's also emotional. So I remember, I'd like to give, I guess, some examples here, but the emotional side of things, I think, is probably what leads to, quite significantly negative, core beliefs. And because they happen a lot, and they're quite subtle. People don't really, I guess, connect to what the emotional challenges or difficulties might have been as they're developing. We don't have the cognitive skills. Parents are probably trying to do the best that they can with the skills, tools and backgrounds that they've got as well. So trauma can be things like this. So, I don't know, maybe I'm a young kid and I fall over. I graze both my knees and I'm told to just get up and shake it off. Then next week, no one picks me up at school or mum or dad's late. I'm told, just get in the car, hurry up. These sorts of things. And if those things are kind of happening repeatedly, I don't know, the child might sort of, unconsciously start going, don't really get my needs met, and so am I good enough? Am I worth something? And I think those kind of gather in a bit of a basket, so to speak. All right, and then the basket gets heavier and you're carrying that around a little bit more. And it starts to colour probably how I'm viewing myself and the world, essentially. So does that kind of answer your question? Yeah, cool.
My question is, as a psychologist, do you believe in the attachment theory? And also if any particular attachment styles are more prone to ADHD?
Yeah, good question. Look, we're all a product of our experiences, yeah. And the research kind of says that the better attachment we have, probably the better outcomes with regards to being well adjusted. Attachment styles. I'm not a full bottle, I guess, from the research perspective on, what's going to be presenting, I guess, with ADHD. But yeah, I'm happy to get back to you on that if you want some further information.
Okay, I'll get in touch with you by email. Thank you.
Yeah, it's kind of what they do and don't do, So look, if no one's around, am I fending for myself with little feedback on that? Am I making the right decisions? Does that undermine my self-confidence? Do I get adequate feedback? If I'm kind of fending for myself and I'm not sure if that's kind of the right thing to do, or maybe I'm parenting other children, at a very young age and all these sorts of things. So I would class those things as, maybe emotional traumas as well.
How about if the parents act differently around other people in terms of how they treat you compared to at home?
Yeah, well, I think that can create
around other people?
a level of uncertainty, or how do I manage that? So there could be anxiety towards how someone's going to, I guess, present and behave towards me. Maybe undermine some of my position on things at times. Yeah. So does that kind of answer your question?
Yeah,
Yep.
I guess the other thing is not differentiating between a child that I always love and a child that when they do something that I don't want them to do, or don't do enough of it, are bad.
Right. Yeah.
Love withdrawn. Full stop.
Yeah. So it's all of that kind of stuff.
So
I
what
think
do today's parents do to try to go along a non-traumatic parenting?
own your mistakes. Apologise. Seriously, we're imperfect. But, when you recognise, I guess, a mistake, or, if you don't meet a child's needs, or, if they're upset, you've got to attend to that somehow. Yeah? And I think there's a lot to be said, in showing that you can make a mistake and apologise for that. Yeah? Some people don't know they're making a mistake, so that's difficult. it's very complicated, but I think is, apologising, owning your mistakes and trying to be different next time, consistent in your approach there as well.
Magic.
Right, thanks for helping me pad that out, that was awesome.
I should have been there. Let's see whether or not the clicker works.
Okay. Does it work?
If it doesn't, Cindy's got a magic
I'm going to be a
clicker
magic
attached to her
clicker.
finger.
Yes, thank you.
Right, so Jason's gone over this one before as well, but comorbidities with ADHD, generalised anxiety, around 20% of ADHD will probably have some generalised anxiety. Same for major depression, 25% will have some form, potentially of a substance use disorder, current, minor or previous, and potentially some other neurodeficits as well. Common to have ASD and ADHD, these things kind of go hand in hand. All right, so what are the shared symptoms here of ADHD and trauma? So I guess, we talked about the DSM-5 before. I won't bore you with that kind of stuff. But ADHD, look, this inattention and hyperactivity, the core kind of, symptoms. They're not the only symptoms, however. So I guess the DSM, yes, it is, a standard, document and with a bunch of criteria in there, but it's always good to have the psychologist doing quite a comprehensive, clinical assessment at the start. And even if someone's perhaps not meeting criteria on screening, questionnaires and so forth, ADHDers are known to be chronic underreporters. Their symptoms, they've only got one lens and that's their own. So delving further into how they might be compensating for certain types of traits and symptoms should be part of the clinician's approach. But you can see here, look, if someone's inattentive, then obviously they're going to have concerns with concentration and distractibility. And so too, look, if I'm traumatised, all right, how good's my memory, attention and concentration? Probably not so good. There'll be challenges with other, executive functions. Some of the parts of the brain that are involved in, managing goal-directed behaviour affected by trauma, as well as ADHD. There can be restlessness and inappropriate and risky behaviour. Like how often, have we seen, in the wider community and on the news when someone's got trauma, perhaps they're using substances and self-medicating and self-soothing in other different ways. That can also come out with ADHD following the dopamine trail. All right. So up here again, looking at depression, anxiety, bit of overlap there in the middle with ADHD. So coming back to my particular story, would you say that I had a significant kind of, impact on my functioning in an academic sphere? Yeah? All right. What about my relationships? Yeah? All right. At the time, I think I went and saw the school psych and then saw another psych, outside of school as well. And is, diagnosed with depression and anxiety. So I wasn't probably the particular kind of presentation that you would see. I'm not bouncing off the walls. Males obviously, stigmatised with those behavioural problems, probably with ADHD. So it's probably more the inattentive type, perhaps, even though I've got the diagnosis combined. And you'd probably say my hyperactivity is probably more internal, really, from a verbal perspective, cognitive perspective, overthinking, and trying to maybe even quell that with a bit of my physical activity with sports and things like that. So a lot of things have actually become, yeah, I guess I've become more conscious of or aware of down the track. Okay, so what are the evidence-based approaches? There we go. I hope everyone's heard of these. So for trauma, I guess the biggest ones that are probably utilised at the moment is CBT, trauma-focused cognitive behavioural therapy, EMDR or eye movement desensitisation and reprocessing. Love that one. Can be very quick. Obviously, some people may need more than a couple of sessions, just depending how much trauma there might need to be processed. Often good for ADHDers who might not want to talk too much. Gets people focusing on what's actually sort of happening in their body as well as their mind. Trauma tends to play out, not just in the mind, but in the body as well. All right. And schema therapy is, I guess, a longer-term therapy, looking at how people probably view the world and themselves. Has everyone heard of schema therapy?
No.
Yeah?
No.
Okay. Yeah. So there's a bit of attachment stuff in that as well, and looking at development across the lifespan, as well as there's a bit of cognitive therapy and there's some experiential stuff with imagery and I guess trying to re-script the past and have someone meet their own needs. The therapist assists them to, I guess, identify how they're going to do that. Yeah. Tapping into their strengths. Obviously, medications and pharmacological interventions are a high priority in this area. So sometimes there's an element of stabilising the person with medication, but that should always, in my opinion, go hand in hand with therapy and trying to, I guess, maximise that kind of intervention as well. Mindfulness and dialectical behaviour therapy are, great interventions for ADHDers and for trauma. Mindfulness itself, I believe, is a good one for helping people's attention. It's very difficult, I think, for ADHDers, especially probably if you don't have a good understanding of exactly what mindfulness is. So people think it's kind of sitting on the floor cross-legged and trying to keep your, self, I guess, centered and focused on one thing. I can't do that, my mind's so busy. That's great, because the more your mind kind of wanders off, and you've got the ability to kind of catch that, well, I'm actually, starting to move my attention around more consciously here. All right, so I might actually be training up, some of those impaired executive functions in a way. Okay, and starting to create an ability to notice things more, and then not divert, it's actually sort of holding your attention on things that are actually perhaps more relevant, not where your mind's taking you. All right, the last one is some psychoeducation and coaching. So coaching is like probably a growth area at the moment for ADHD, but that is looking more, okay, well, what are your goals and how do we go about reaching them? If you're anxious, go see your psych about that. So hopefully, people are doing those sorts of things in conjunction.
Is there also sort of like ACT, like acceptance and therapy? Is that like upcoming in that sort of area as well? Because that's another one that I've heard of that's been useful for
look, ACT, there's a lot of mindfulness-based stuff in there. There's a bit of some solution-focused stuff, looking at people's goals, values, and getting them aligned with those. It's probably a good point, in terms of you see a lot of misalignment in terms of, I guess, people's behaviour and what their goals are. So actually exploring, you know, I guess strengths and stuff, I think that's probably one of the next slides actually, you know, should be at the top of the list as well. And, you know, it allows people to see, you know, where they're kind of diverging, you know, and not aligning themselves with, you know, their key kind of qualities and characteristics that they want to kind of display and be seen by. You find that a lot, I guess, with trauma and ADHD. There's no lack of kind of motivation to probably try and do the right thing, and I don't think there's any lack of intention. Just can't. You know, so yeah, the skills, tools, strategies, you know, one of those that Jason was talking about, you know, it's obviously very pertinent there. Very difficult too. Alright, so collaborative treatment planning with both ADHD and trauma, look, it needs to accommodate what the person's preferences are. Alright, there needs to be a discussion of like, what does this person want? You know, the therapist should be checking in, I think, and actually going, look, are we on the right track here? These are my thoughts, give us your opinion. The needs might change across sessions. Maybe it takes a long time to build rapport. So we have to be patient. Alright, everyone wants something fixed yesterday. But if we, I guess, think about how long it might take for someone to come into therapy, or how long they might have been suffering in some way, shape or form, then being patient is a really good thing. That's part of the psychoeducation perhaps that the therapist can give the ADHD. And individual goals, like what do you want to get out of it? What are the strengths that you can actually bring to the therapy table? Yeah, what else is going on that probably needs to be addressed at that time? Alright, what's the priorities? These sorts of things. Now this is my little bugbear. Clinicians, clients and organisations, alright, I think employers can have a huge part to play here. Putting a bit more of a strengths-based lens on here. ADHD is not a problem kind of to be solved. It's like it can be managed, moderated, regulated, and we don't have to apply, you know, stringent, I guess, rules and protocols and all this sort of stuff. The best source of, I guess, those kind of protocols, if I put them in inverted commas, is the person themselves, and they'll probably know what works for them. All right, it's about sort of giving an opportunity to let them be heard, essentially. Those sorts of things are going to aid them feeling less stressed, less depressed, less traumatised, both at work, in the community and at home, and probably modify a lot of, I guess, the presentations with comorbid conditions as well, if we're kind of using someone's strengths to help them heal and recover or manage a condition. So just to show you that ADHD is, we can be successful. We've got Whoopi Goldberg up here. Everyone knows Simone Biles, the legendary gymnast. And is it Emma Watson? Can't remember. Yeah. So yeah, they certainly, I guess, probably use their hyper-focus to great advantage here as well, in the roles that they've actually assumed for their careers and whatnot. All right. Strengths, passions, and trauma processing. I find that a lot of ADHDs actually have an entrepreneurial passion. I've certainly had one, and run my own business with a business partner. So I'm probably a bit more of the people person, and happy to chat to anyone and do all the networking, but managing the finances, oh my god. Like, I delegate the hell out of that. I've got good templates in place. Most things are automated. I've got solid reception staff around me, and they're keeping me honest with even how long I take in sessions. We've got a little code where I'll get a tap on the window or something like that, and it's 20 past. So like, if you want a good value session, just keep Matt talking. ADHDers have this thing called cognitive dynamism, if I said that correctly. We're good at divergent thinking. This is where the hyperfocus kind of comes in too. We're creative and very adaptable. I can remember my psychiatrist actually saying, look, Matt, I'd rather be behind, if I was in the army or, if I was working for St. John Ambulance or the police or anything like that, I'd want to be behind an ADHDer. Right? Because they'll just charge straight in, get shit done. And maybe their attention span that's required, like in that time, the adrenaline's up, they're able to focus, I'm going to do this, I'm going to come back to that, and how's that person going? I'm over there now, and have you done that? Oh, how are you going? Oh, birdie. So that can be very advantageous. They'll probably think about it too much afterwards, though.
Is it also people who study last minute?
Sorry, say.
Is it typical of people to have ADHD who study last minute only?
Yeah.
Yeah.
Yeah, pretty much. Look, there's exceptions to every rule. Maybe I'll talk to you about that later. Courage to be maybe different, non-conformist, usually quite adventurous. If there's something novel, I'll do that. Stand aside, let me do it. I guess if there's been, some adversity, I still kind of, went back to stuff. I've seen a lot of my clients, even not know what they want to do career-wise, but they're quite good at finding something else. They might have done that 10 times in 3 years. But they still get there, they still survive. All right, so there's some resilience there. High energy. The humanity. They kind of know what the challenges are. I think they're relatable. Some are happy to share, some are not. They can learn to share. They can learn to probably be more conscious about how they're going about things, and how others perceive them too. Transcendent, so I think they're able to kind of go, hey, here's the other side of the coin here, or this is what I see in that person. Maybe they're presenting that way because, I don't know, someone cut them off before they got in the office, or that email you received, read it again, it's not as bad as what you think. And we're really good at using our senses, I think, in some situations. Some might get overstimulated and need a break, but this can be, a bit of a strength in some of the trauma processing stuff. Okay, so if you want to go and see a psychologist, maybe you've got ADHD, maybe you're the sibling, the partner, the parent, what questions do you ask? Alright, so what's their approach? I think is the first one. Alright, like what interventions do they use? How do they go about building rapport is a good one. Alright. Do you be collaborative? Are you flexible enough to change things when you need to? Are you forceful enough to say, no, we're not changing that because I still notice this? Give me your thoughts on that. Experience and training. You need to see someone who's experienced. Alright. And has a passion, I think. They know what they're talking about. That can be very good in terms of trust and communication. Do you believe in using meds, nutrition or exercise as adjuncts to treatment? there are so many factors that need to be considered with ADHD. Each one's got a place. And I guess for adults, the first, kind of protocol, the thing that actually reduces, the most amount of core traits and symptoms is actually medication. All right. So I think it accounts for about 60 to 70% of reduction in symptoms in adults, with therapy being additional to that. Okay. Yeah, look, I think it's a discussion, from a medical perspective as well. Yeah. But look, it always comes down to, the advice of the treating practitioners. Yeah. And that's in conjunction with your needs, wants, and personal preferences as well. I'm not sure if anyone's seen the ADHD best practice, clinical guidelines from AADPA. I'm happy to point people to a link for that later on if you like, but yeah, there's a bunch of information in that, not only for the ADHD but for everyone that might be involved in supporting that person, which outlines the needs, wants, and the way of actually going through diagnosis, the education afterwards, the treatments, and each and everything in between that as well. So that might be a nice document. Things need to be reviewed pretty regularly as well. It's okay for things to be said, in one space or at one time frame, but is that still applicable always? I'm not sure. So, constantly reviewing that and seeking, some further information is a good thing.
Could you just repeat that acronym, ADHD blah?
Sorry, say again.
The name of those guidelines?
So it's the Australian Association of ADHD Professionals.
AADPA.
Yeah.
GPA, okay, thanks.
Yep. So I think they came out in October 2022. So it's the best practice guidelines. Yeah. There's a PDF that you can grab online with that one. Yeah. No ADHD is going to read it. It's over 200 pages long, but there is a summary of 25 pages, and I think I got to maybe 10 pages. All right, and how do they work with the practical issues of ADHD? All right, so it's not just the self-esteem, it's not just the anxiety, it's not just the potential trauma. How do they motivate people? Right, how do they get them initiating things, shifting their attention? How do they get them to remain on task or know when a task is nearing completion? How far do they think they are through a task? Yeah. How do they manage their stress when they are going through something? All right. All of these things need to be taken into account. All right. Now, kind of at the end, so I'll open that up for some exploration here. I just want to sort of finish this with, a little bit of a statement perhaps on how I've probably managed trauma with the ADHD clients that I've had, and maybe even just give you some insight into some of the therapy that I've actually had, managing some of my stuff as well. So look, I've always taken the approach of going, okay, well, how does stress, anxiety, depression, how does trauma and stuff play out in someone's body? All right. So I'm not sure if anyone's seen this type of, I don't know whether it's an analogy or an exercise perhaps, but has anyone seen this in terms of this is your midbrain? Yeah. Limbic brain, thinking brain? Yeah. All right. So your midbrain's dealing with threats in its simple form, all right, and this is connected through your spinal cord into your body, all right. So a threat can be external and physical, so a big dog's going to bite me, or a threat could be, oh, I've got a big bill in the mail and I've got no money and I don't know how to pay it, all right. So your midbrain, primitive brain's going to respond to that, whether it's physical or cognitive, and it starts firing. Limbic brain on top of that is kind of where we feel safe and attached and stuff like that. Alright, and then obviously thinking sort of is on top of that, thinking brain. Okay? So if my midbrain's firing, then the limbic brain's probably going offline and then the thinking brain's going offline. But then that's connected into our body. Alright, so we're likely to feel some kind of, I guess, tension, or the heart rate's up, or the breathing rate's up, I get the shakes, I feel hot, all of these sorts of things, sick in the stomach. Alright, so if that's playing out in the body and I'm not feeling overly safe and my thinking's gone offline, are we going to use, I guess, a cognitive approach, like what I call like a top-down approach, to try and manage that in the first instance? No. So I think doing some body-based regulation skills to kind of calm the body and try and calm down the midbrain, so we can get everything else back online, is a good thing to do. I often like to use like gentle movement, bit of mindfulness, getting people to focus, I guess, on sensations, alright, putting their attention into different parts where things are playing out, and also getting them to map out sort of what triggers those sorts of things, and then also what can, I guess, calm those things down. And they're usually sort of action-based. So with ADHD, if I'm prone to being restless, or hyperactive, I don't want to be sitting still, so gentle movement's a good thing. Stretching, breathing, putting your hands on your chest and your stomach, all of these sorts of things, and then trying to divert your attention into those. We also map out, I guess, from a strengths perspective, like if I think about my past, say, like I love my exercise, alright, so what else can I do that provides me some kind of benefit, whether that's dopamine in the sense of fun, pleasure, or achievement. And so I'm not reinventing the wheel. It's not another chore, another task that I actually have to do. I'm, I guess, using something that I've actually got a little in, to be able to create a sense of improving my dopamine level, perhaps. Alright. So picking out, I guess, what's worked in the past, exploring how people go about managing things in the past when they weren't so stressed, and externalizing that again, so it's on a piece of paper. It's stuck to the back of the door. I see it all the time. Right? I know where it is. I've got to go to the place. I only have to remember one thing then. So practicing that in real time in the session, rather than just going, go away and do this. Like, we need some kind of buy-in. We need to actually experience that firsthand to know that it actually bloody works. And be more likely to do it. Alright. So that's my little on the horse statement. Questions?
Sort of a question and sort of a comment. Going back to the trauma side of things, I think one thing that is not being talked about enough as women with ADHD is, I know that it was alluded to about the social expectations, particularly if you have children or a family and partner, that social expectation to create a nice home and to show up and do stuff with your kids and to join the PNC or whatever else it is. Otherwise, to hold down the job and be a career woman. That we don't talk about how impossible it is in a lot of cases for a lot of women with ADHD to perform at that level, and the judgment and the criticism that is absolutely fucking relentless. Obviously, it's still a thing for me. And that trauma, like, you don't see that necessarily until you're an adult. You don't experience it until you're an adult, until you think you're going to grow out of the best behaviours, and as you become an adult, you get told, oh, you'll grow out of it, you'll start using money. That's not necessarily the case. You don't. So when you have those kinds of expectations, and obviously you internalise that shame and that stigmatization, right? What do you treat first? Do you treat the ADHD first, or do you treat the trauma surrounding that, or how do you go about negotiating with your psychologist or your coach or your psychiatrist how to unpack some of that? Yeah. And particularly when you're told that you failed as wife and mother, which, you know, as a woman, those two things, a lot of us aspire to be reasonably placed at.
Yep. Great question. There's a lot in that. Look, I think you even noted like a lot of different sort of transitionary periods. Like, you know, like it's not just going from a kid to a teen to a, you know, young adult and then a mother or anything like that. There's school journeys in there. Maybe I got a promotion at work, right? Or now I'm actually like a full-time mum. Well, that's interesting, like the transition
or
as
your
well.
whole body changed because you had a baby and your body is not yours anymore. It now belongs to a squirmy infant.
Yep. Yeah.
It happens.
Yep.
It's a reality of the situation.
Yeah. Yeah. So yeah, there's still a lot of those you know, traditional kind of cultural norms that are, I guess, playing out and impacting things there as well. In terms of what to focus on, like, you know, what's brought the person in the first place? Like, so they're like, oh, I'm just distressed, or, you know, all of these things are happening. All right. From I guess, a therapist point of view, crikey, I had a client, you know, like their background could be a movie with the amount of stuff that was, you know, going on there. I actually went and sought some like supervision on this one, but like it was really, really helpful. But like we put every single experience, you know, that was divulged like through the initial kind of session. Like it probably would have taken 3 sessions to get everything together. I'm sure there was more stuff, you know, later on. Because it's like, well, where do we start? Like we didn't know. So the collaboration and sort of asking is the biggest thing. Maybe for the client to actually go, well, what do you think is most important here as well with therapists? But like we sort of got those, you know, say for those big things, we then sort of themed them into like, you know, well, this is safety, this is drug and alcohol stuff. You know, this is, you know, anxiety related. This is to do with parenting, yeah. And then we kind of ranked them, you know, like where's the most dysfunction, or, you know, where is the most the biggest mood impact, or, you know, like there was even financial stuff going on in there, which, you know, had career and all these sorts of stuff like attached to it. When you're actually sort of getting that externalized again, the person then goes, oh crap, like, you know, there's 10 things over here and there's only 2 in that bucket, but then it's like, well, the 2 over there, are they more significant or nasty than those 10 together? And so even a mind map sometimes is a good thing to do, and seeing if there's any connections, and where there's the most kind of connections, maybe starting with something like that. But I'm always sort of putting that back on the client, in terms of giving some feedback and, you know, what are the feelings, or, you know, those sorts of things coming up with regards to that. If I'm feeling really brave, I'll share my formulation with someone. You know, so it's a good thing to look at, you know, sort of what's happened before, you know, what's currently happening, what's keeping things going, but on that kind of more protective side, what's actually going okay. Yeah, so that's where you'll probably find, I guess, some link to the qualities, the characteristics, the strengths, passions and things like that, which you get people doing, I guess, more of. Like that's probably the easiest bit. And maybe that can help them sort of manage some of the other distress over here. It gives them a little sense of, hey, I can do it. Then you might be away with actually being, you know, reinforcing that that person can kind of get better. Also highlights, I think, to them that, you know, there's some other things that they can kind of put their attention to and amplify. So, does that kind of answer your question?
Just the other side of that is also how realistic is it to expect someone to do that in a 10 session for you.
Well, yeah, it's almost impossible. So, thanks, government. I won't.
You're preaching to the choir.
Yeah, so like it'd be great to go back to the pre-COVID or during COVID kind of levels. That would be great. But yeah, you're preaching to the converted and trying to get greater access to sessions at a cheaper rate.
All right, now we did hear Matt say that if you want to have a good session, keep him talking. So we're not going to take any more questions. So we're going to hand over to Cindy.
Thank you, everyone.